Hello everyone, I'm Dr. Divya Sharma. I'm a dermatologist with special interest in pediatric dermatology and trichology. I am practicing in AECS layout 60 feet road and in the area of Brookfield since past 6 years. So atopy is a tendency to have allergy wherever body is in contact with outside, and atopic dermatitis is the skin manifestation of it. Atopic dermatitis is a chronic inflammatory skin disorder where the primary problem is a barrier dysfunction. As you know, our skin is basically like a wall. It has a brick and mortar arrangement where the bricks are the skin cells and the mortar that holds our skin together is natural moisturizing factor. Natural moisturizing factor is composed of ceramides, cholesterol and free fatty acids in an equimolar ratio of 3:1:1. Now, the primary defect in atopy is due to some genetic reasons. There is a dysfunction in the synthesis as well as the quality of this natural moisturizing factor, which is deficient in these children. So, if the mortar is not great, anything can penetrate the wall and cause allergy. Now, when it comes to prevention, as I said, it's primarily a barrier dysfunction. The first and foremost thing that we can do to prevent atopic dermatitis is to use a moisturizer, rather replenish the natural moisturizing factor with a moisturizer that resembles chemically the equimolar ratio of the natural factors. So a good moisturizer would form the cornerstone of prevention of atopic dermatitis. Number 2, these children do secrete natural moisturizer factor, although in less quantities. We have to retain that. So we also have to, follow certain cleansing practices. We have to avoid certain rituals and practices which cause further drying of skin. For example, we should give bath to these children for as minimum time as possible, possibly 5 to 10 minutes, using a cleanser or a soap that is not drying. I would prefer a Syndet over a soap, as they are soap free. We should prefer a parabens and a fragrance free Syndet or a body wash. We have to use small quantities of it, on the contrary to our traditional Indian practices where we believe in applying a lot of soap and water. I would say we have to minimize that. So choose a good soap, use it in minimum quantities. Do not extend the bath beyond 5 to 10 minutes. Make sure that you pat dry the child and apply the moisturizer immediately after bath and once before you sleep. Few other handy tips that come in preventing the flares. I cannot say that we can prevent it totally, but we can definitely minimize the exacerbations would be. Do not, make them wear clothes, especially the ones which are made of wool and hosiery and fabric. It's only 100% cotton that is preferred in these children. Number 2, avoid using, fabric conditioners, fragrances, Dettol, Savlon and other antiseptic solutions. Number 3, we should make them not play in the sand quite often, as sand itself has an abrasive effect on the skin. Number 4, try to keep the environment as humid as possible. Avoid using air conditioners for long. Use an air humidifier if you stay in not so humid climate like in Bangalore. And number 5, make sure that you use the moisturizer more frequently.